This food and this opportunity to be together and exchange ideas. Amen.
Amen.
All of us here wouldn't be here without Dr. Mason and all the pioneering work he did, and it's a real honor and privilege to be here with everybody.
Well,
So thank you for allowing us to be here.
you'd probably be doing something else in another field.
I set up 2 studies. One of them obviously was to treat peptic ulcer. Had 8 patients in each study, and one of the patients was relieved of his ulcer symptoms. And he also lost weight. He was very heavy. But for the obese, we had much better results. All 8 of them lost weight. So we were 70 surgeons helping each other by use of the telephone and letters. I had read in the news that if you watch children coming out of school in Japan, you could see that they had a problem in obesity. And so when I was asked about this in 1981, I decided if they needed a society, we certainly ought to have one. We already had one. All we had to do was change the name of it.
Yeah. It all started here, huh? It must have been hard to organize everybody. This was before email and everything else, so everything was done by phone and letters, huh?
Well, I just left that up to Tom Blumers. After it was developed, we were able to show that gastric bypass stops the secretion of gastrin. I remember now, yeah.
It's much smaller than it is now. It's changed quite a bit.
So are the patients, or vice versa.
That's true.
When I was beginning my 2nd year in medical school, I wrote Dr. Wangenstein in Minneapolis. There are two people who have been recommended. One was Wangenstein, and the other was Lester Dragstead.
Oh, sure.
And at the time, we were worrying about Sputnik. And I decided it'd be safer to work in Minneapolis than Chicago.
Because of the Sputnik? Very interesting. That's a story.
Yeah.
Less of a target, huh?
That's a story. Wow.
I had a patient that had a jejunal bypass, and I took it down and gave him a gastric bypass.
You only took it down.
And then he gained a lot of weight. And I finally restored the intestinal bypass. So then he had both the gastric and intestinal bypass.
Oh, boy.
Did that work?
And he worked in our hospital operating room cleaning instruments. He had lost his leg and hip in a farm accident.
Well,
So he was an example of an adverse childhood event. And he continued to smoke and eat what he could. Finally got him under control with 2 operations.
wow.
I never performed intestinal bypass as an initial operation. My dad was a professor of journalism here. This was home.
So this is home, yeah.
His mother was an
At one time, we thought maybe we'd use the setup over at the university. The head of that brought a printing press, a small printing press from France, and converted it to a reader of answers of a questionnaire. And that was what paid for a third of the first mainframe computer in the University of Iowa. They sent a questionnaire around before they even had anybody, even before they bought it, wanting to know who would be interested in it, and I said I would be interested in it. And I used to write my programs on Hallruth cards,
Oh, wow.
take them over to the computer in a shoebox, and they'd print them and run a test, and I'd pick up the results and take them home and make the corrections needed. And we have a grandson now, Rosemary's boy, who finished up his electrical engineering and computer science here at the University of Iowa, and he's
And went to Purdue then,
He's at
now.
Purdue, and he's just about finished with that. He has to take his exams.
No, but I remember Dr. Mason and Dardana standing near a booth at ASBS, trying to, I would say, entice people to use the registry. What you told me one day, the story about your first poster at the American College of Surgeons on gastric bypass, that few people would stop by, correct? Is that correct?
Few people?
Yeah, people were not interested, correct?
No. We got all our patients as referrals from friends and relatives. Finally, surgeons or physicians started referring patients because they were desperate.
Meeting, they decided that you were going to be the president. Who decided that?
I did.
You did. That's a good. That's a good
Yeah.
I'd been
Of
doing
course,
it for
right?
7 years.
Yeah.
And so, and I decided I would keep it for 2 years.
Yes.
Okay.
Who decided who was going to be the second president? Was several members? You had a board, executive council, or you just got together and voted for somebody, or you decided who was?
No, we copied other societies. We had a group that put somebody up,
Nominating committee.
Nomination,
and they
yeah.
could, and then we voted on it.
Okay.
And there was at least one meeting when some individuals got together and appointed a president that had not been put up. You want to know what I'm most afraid of?
What you're most proud of.
Alfredo.
I'm afraid of being buried in email. I think 20 years from now, you still will be doing obesity surgery, but you will triage towards getting the most for your time. If a patient has diabetes and can't breathe and going to die from one or both, that patient will certainly take precedent. You will never exceed operating on even 1% of the candidates.
This is not going to get better.
Why is that?
And this because of the two epidemics. The epidemics we used to talk about 30%, now they're talking about 50%. You can't treat an epidemic with surgery. So what the surgeons can do, and what I'm so happy to see you here for, is to take the idea of, or the importance of osmolality and how high concentration of contents entering the upper bowel act like milk of magnesia and cause a flush, and that gets the stimulant, glucose and other stimulants, to the L cells. And so that cures the type 2 diabetes, and you can use that to address the epidemics. We should be resolving the type 2 diabetes epidemic right now. It's been 15 years that I started writing about the mechanism, and you know that I've given a lot of references.
You did. In your column, at Basin at Large.
Yeah.
I don't think anybody reads the references. And Dr. Wangenstein, I'll show you his book, but he claimed 36 years ago that empiricism had been replaced by science. Not totally. You can figure out a way to stimulate the hormone, then you can get rid of surgery.
They,
You can't analyze data if you don't have it.
that's right.